And just before the break, we told you about a bigger conversation we will also want to have with some heads of some MMDAs, and we have a couple of them on stream, so we'll just introduce them to you, and we're ready. Good morning to you. Okay, so we're can you please introduce yourselves? Good morning.
Hello.
Yeah, good morning. Please.
Good morning.
Please introduce yourself. Well, so we have Dr. Jacob Mihama. He is the Western Regional Director of Health, and we'll put him on your screen very soon. And alongside him, we also do have a representative of who is the MCE for Lower Manyakrobo, Simon Kwekutete. Good morning to all of you.
Good morning.
Yeah, great. Now, we want to have a bigger conversation on the subject of making sure we enforce the various protocols in our various areas. And I have to start with the Lower Manyakrobo MCE, Mr. Kwekutete. How are you doing that in your area? Well, let me then transition to you, Dr. Mihama. If you look at the protocols as they are, and even the appeal from the Minister of Health and the various experts who are working on this nationally, how should the various MMDAs be enforcing this in their locales?
Yeah, thank you very much for having me on your show. Yeah, the DCs are actually playing a very big role in the prevention of, in enforcing the social distancing and the wearing of face masks. If you look around, all the reports that we get across the country, you have difficulties with the markets and we wearing the face masks. So I think you're able to use local bylaws to enforce the use of the face masks and also ensure that the social distancing in the market, I'm sure, to go a long way to actually stop the spread of the COVID virus in our communities.
And it's good that since you manage the related issues of public health in the Western region, and you're familiar with the way the social distancing rules have been done, for example, in the market, etc. How did you drill down this sort of information for even the heads of the various MMDAs in the area to take it up?
So here in the Western region, we have a task force led by the regional minister, and he's doing all that he can to enforce all these preventive protocols. The task force, for instance, anytime there's a rumor or there's a call that there's a gathering somewhere like people playing football, we have gyms and other things, they quickly go there and quell it. And the markets too, in the Takwade market circle, we have a lot of crowds surrounding the market. All those crowds have been moved to the Jubilee Park, and then where we're trying to manage the crowd in the center of town. I mean, we had a lot of donations of our PPEs, which the minister has also distributed to the various MDs and also the facilities in our region.
It started so well. Is it still continuing that positively in terms of the social distancing, how you're maintaining the wearing of face masks and the washing of hands in the Western region?
Yeah, it's not very different from other parts of the country. It's really very difficult. You know, it's a human society. And it's very difficult to get people to understand that we need to do that, because when they don't have the actual deaths happening in their communities, they think those things that actually don't exist, and then we try to infringe on their freedom or to do whatever thing they want. Nonetheless, we're doing all that we can to ensure that the masks are used. Right now, you can't enter a facility without a face mask. Even though I don't have a face mask, I ensure it here, and I use one before I came into my office. So that one, we're trying to ensure that in the RCC, all offices, we have the notices pasted there, without a face mask, you don't enter the facility. And we are hoping that this will also extend to other communities, other organizations in the city and around the region, so that you don't wear a face mask, you don't actually enter. All the banks, all big businesses in the commercial center, they have not only wearing of the face mask, but also they take their temperatures, they ensure that you wash your hands properly. You come into, they let you rub the sanitizers before you do whatever you want to do. You don't have it, they don't let you in. But the other problem is with the commercial drivers. That one's very, very difficult to actually ensure because we still see people crowded in vehicles moving around without face masks and also crowded in the vehicle. This is a challenge which I think the MDC should have to tackle.
The behavior of the citizenry ultimately has an impact on the public health and ultimately also affects the way the cases are reported at the various hospitals. How do you do that transition to make sure that the various hospitals we have in the region are not inundated with a lot of cases?
Okay, luckily we just had our veterinary labs working, and then they're speeding up the testing and giving us the results. So this one we ensure that wherever the samples are taken, we make sure that they're prepared and sent to the veterinary lab. Now we had a few cases, and so the number of contacts that we've actually has risen. So there's a little backlog at the veterinary office. So because of that, we've actually sent some to Accra. We took about 1,000 test samples to Accra for them to be run. And by the end of the week or the beginning of Monday, we should have the results in. So we, on our part, we're trying to, as soon as we get the samples, we try as much as possible to let them have the results. Because the anxiety of waiting for results is not easy. So that's on our part, that's what we are doing.
There's a particular case at the Fia Kwanta Hospital in which we've had some closures also at some of the departments there. And we also know that it's because of the exposure. How are we resolving that?
Yeah, this one is about an auxiliary staff that she has actually volunteered. She wasn't feeling fine, volunteered that her sample should be taken. It was taken on the Monday, and then it turned out positive. So we decided where she's working, she actually works at the ANC, and she used to work with the ENT, so she frequents that place. And the ANC and the Child Welfare Center are actually one place. So we decided, fine, once the result has come out positive, we are going to decontaminate the place and then also take samples of her immediate colleagues to ensure that they are not actually affected. So that's what we're doing now. And then today we are going to reopen the place.
Well, let's turn our attention to somewhere Accra. We have the Wejagba, we MC also on stream, Patrick Kumo. Mr. Patrick Kumo, can you hear me? Mr. Kumo?
Yeah, I can hear you.
Oh, great. Great.
Yes, I can hear you.
Yeah, great. How are you enforcing these protocols following what the minister incessantly has been talking about?
Yeah, good morning to your cherished... Right, good morning to your cherished viewers. I believe with the inception of this virus in the country, which place to make sure we are ahead of the virus. When you come to my municipality this very morning, I can confidently tell you that we are no longer hotspots. If you listen to the president's last speech, the assemblies that were mentioned with Jagbawe was not part of it. This is all because of the pragmatic trying to be ahead of the virus. People that the case in my municipality now is 71, and then 18 persons have recovered. We are doing this all in partnership with the Health Directorate in the municipality, and I would like to use this opportunity to comment where this very morning we have mounted some roadblocks in some major streets in the municipality.
Well, we seem to be having some difficulty with the internet connection for Mr. Kumo, so we have to let him go. And Mr. Patrick Kumo is the MC for Wejagbawe right here in Accra. But let's focus on you a question or two before we let you go, Dr. Jacob Mihama. Ultimately, these exposures of health personnel would also mean that they need more protection. How are you going about the testing beyond just the voluntary ones that they themselves opt for?
Yeah, Actually, this was a single voluntary testing. So we are making sure that all the positive cases, we take their contacts, the immediate contacts, and then also we try what they can also remember beyond the 14 days. Then we do that. And where we find a clustering of positive contacts, then we'll do an enhanced contact tracing. That's what we're doing. And I just want to add to that the regional minister is also has got an isolation centers that they're actually financing where we move these positive cases to.
But look, we also do know that ultimately it would have to come to a head as to what the plan should be. And now that it's more of community spread, it also means that education needs to be enhanced. Is that ongoing, and how are you doing?
That is true. That is true. Every morning we have a health promotion officer in one FM or the other.
Okay.
And then in every district, the DHMT is also engaging in community conversation with the people in the community, trying to bring down stigmatization. That is the most important thing. Once you are infected, people think they should keep away from you. That's a paradox. When you are infected, people don't come near. At the same time, people think the disease doesn't exist. And so they don't want to actually wear face masks and practice social distancing. So that is the problem that we have now. But as much as possible, all our staff, right down to the chief compound, they engage in some form of education, trying to ensure that people practice all these preventive protocols. But for now, there's no cure. So all that we need to do, even when they're infected, is just symptomatic treatment. So the best thing is to keep away from it and don't get infected. So this is what we told our staff. And every day they are on it. And also at where we have FMs in the district capitals, every day they are also on the air trying to allay people's fears and also educate them on what to do, ensure that we don't get infected.
Well, thank you very much. And very comprehensive brief from you, Dr. Jacob Mihama. And now he is the Western Regional Director of Health, helping us with a greater conversation as to how the various MMDAs in the Western region have been going about business, making sure that they provide education, as well as take care of the various health facilities and the personnel, and also engage with a team that is headed by the regional minister to fight coronavirus. Where, again, I have to take a break. When we come back, we have Flokin Stone, who is our artist for the next segment. And Mama View Sabwaji comprehensively will have that interaction for you. Stay with us.